Hey, welcome back to Community Health Paramedicine. This is going to be Chapter 17. We are talking about communication strategies for children with special needs. So let's jump on into it. So let's start by looking at what we mean when we talk about children with special health care needs. These are children living with chronic physical, developmental, behavioral, or emotional conditions who require additional support and services beyond what is typical. As CPs, our involvement often extends into the home, offering preventative care and follow-up that can help with long-term outcomes and improvement. Pediatric care forms its own niche within community paramedicine. One example comes from a demonstration project at Indiana University in Milwaukee, where community paramedics identify risk to infants while they're at home. This reduces infant mortality through education, assessment, as well as prevention. So it shows how powerful our outreach can be when we focus on prevention. I know this is not something that is a focus currently for our Western Carolina community paramedic programs, but is definitely a direction that we're seeing some programs down east start to take. Our role doesn't stop there. Community paramedics often support children with chronic conditions like asthma by providing follow-up care, monitoring symptoms, and reinforcing the physician's plan. These interventions help reduce ER visits and improve a family's confidence in managing their care. While our specific responsibilities in pediatric chronic care are still being defined, we already serve as an essential bridge. The physician creates the care plan, but the CP helps monitor progress, manage symptoms, and educate the family. It's that triad, monitor, manage, and educate, that truly makes the difference and has been a repeated pattern throughout this whole course. When caring for children, understanding developmental milestones is critical. We look at growth through several lenses: gross fine motor skills, communication and language development, and cognitive maturity. Knowing what's normal for each stage helps us recognize when something may be delayed or abnormal. One of the best ways to gauge where a child is developmentally is to simply just ask their parent or their caregiver. Ask what grade level or age the child functions at, how they express emotions, and what helps them feel calm. These small insights go a long way to building trust and helping you tailor your communication with the child. There are 4 main takeaways where developmental delays can occur: speech or language, motor skills, social and emotional growth, and as well as cognitive development. Recognizing which area is affected helps us adapt our approach and provide appropriate support. Communication disorders cover a wide range of challenges involving language, speech, or hearing. These may stem from conditions like dysfluency or aphasia. It's important to listen closely, be patient, and allow the child extra time to respond. Motor and movement disorders are often seen early, sometimes as soon as a baby or a toddler misses their expected milestone, like walking or catching a ball. One of the most common causes of this is cerebral palsy. Cerebral palsy is a neurological disorder affecting muscle coordination. It can vary in severity and may not be diagnosed until later in infancy or toddlerhood. When you interact with these children, remember tone, patience, and positioning all matter. Onto autism spectrum disorder, or ASD. This is a neurobiological condition that affects how the brain processes information in response to the world around them. It's called a spectrum because no two people with autism are alike. Some may need extensive support with communication or even our ADLs, activity of daily livings, while others may live independently and communicate effectively. Children with autism may have difficulty interpreting sensory input, things like lights, sounds, textures, or even social cues. As CPs, we need to recognize that overstimulation can quickly lead to anxiety or behavioral escalation, so keeping the environment calm and predictable is very key when we are dealing with these patients. Children with autism often use repetitive behaviors as a way to self-soothe or manage sensory overload. You might see rocking, hand flipping, or twirling, sometimes paired with vocal sounds like humming or repetitive phrases. These behaviors aren't bad, that's their coping mechanisms. When we see them, we shouldn't try to stop them unless they're causing harm. Instead, we adjust our behavior. We lower our voice, move more slowly, and avoid crowding the child. That helps reduce sensory stress and also builds trust with the patient. There's an old saying in the autism community, if you've met one person with autism, you've met one person with autism. Each child is unique. Different triggers, different strengths, different communication preferences will be had. Some may use picture boards, some use devices, and others prefer gestures or written words. Before starting care, always ask the caregiver, what helps your child feel safe, or how do they prefer to communicate? Tailoring our approach shows respect and leads to better outcomes and deeper trust. Next, we'll look at other common developmental conditions, Down syndrome. While autism primarily affects communication and sensory processing, Down syndrome involves genetic and physical differences that influence growth and learning. But just like autism, our approach begins with empathy, patience, and respect for other individuality. Down syndrome is a genetic disorder caused by the presence of an extra chromosome, most often a third copy of chromosome 21. This condition can lead to developmental delays, cognitive differences, and distinctive physical features such as flattened facial profile, upward slanting eyes, and a smaller stature. But what's important to remember is that these children are not defined by those traits. They're defined by their personalities, families, and their own capabilities. Our role as community paramedics is to meet them where they are, developmentally, just like we would our other pediatric patients. Children with Down syndrome may have several associated medical issues such as heart defects, seizure disorders, GI issues. Hearing and speech challenges are also common, which can make communication more difficult if you are not patient. When you're assessing these patients, speak clearly at eye level and give them time to respond. Many understand far more than they can express verbally, so use a combination of verbal communication gestures as well as visual clues. Your patience and tone of voice will often determine how successful your interaction is. Now, as we move into communication strategies, the most important takeaway in this is you don't need to know every condition inside and out. What matters most is recognizing how a condition might affect our communication, and also being ready with strategies to bridge that gap when you do face it. Effective communication starts with understanding, empathy, and adaptability on your part. Every child deserves to be treated as a child first and not as a diagnosis. Keep them at the center of the interaction. Adapt to their pace and comfort level. Work together with their caregivers as a team. They are the experts when it comes to that child's daily life. When we approach care this way, we shift from simply providing treatment to truly connecting with the patient and their family. There are many possible barriers to communication. So once again, that could be their developmental level, physical limitations, anxiety, language differences, or even the environment like noise or lighting. Recognize that these barriers aren't obstacles to care. They're simply cues for us to slow down, observe, and adjust our approach. When we match the child's communication style, we set the stage for trust and cooperation. Good communication is always built on trust. That is a fact. That trust comes from consistency, explaining what you're doing, keeping your tone calm, and following through. Families and children with special needs often deal with many different healthcare providers, so your ability to be patient and predictable can make a huge difference in how they respond. When performing a physical exam, narrate what you're doing before you do it. Use calm, clear language, and demonstrate procedures on yourself first, if possible, like showing how you're going to listen to their chest or apply a bandage. I think we've all been in the back of the truck and let a kid play with our stethoscope. It gives them some trust. That builds familiarity and is going to also lower their anxiety. A quiet, reassuring tone helps the child feel safe as well and keeps the parent calm too. The next concept is people first language. This is something I always emphasize. It reminds us that children are not their diagnosis. We say a child with cerebral palsy, not a cerebral palsy child. Language shapes perception, and perception shapes care. So by using people first terms, we set a respectful tone and we reinforce dignity, which is so important with building trust as well. Another common mistake is talking about the patient instead of to them. Even if the child is nonverbal, it's important to make eye contact, as well as it doesn't put them outside their comfort zone. Use their names and include them in the conversation. These signal respect and tell the family if you see their child as an active participant in their own care. For children with speech or language disorders like dysfluency, aphasia, or dysarthria, reduce distractions by minimizing background noise, slow your rate of speech, ask simple questions, and give them extra time to respond. Never rush them. Pauses are not silence. They are processing time. For children with autism spectrum disorder, communication can range from nonverbal to fully verbal, but processing delays are very common. Asking a question or giving a command, pause and give them extra time to respond before repeating yourself. Give them that time to reflect and think. Too much repetition or too many words can actually increase their stress. Think of communication as a rhythm. Slow, steady, and predictable. Children with Down syndrome may have difficulty forming certain sounds or words, so speech can be hard to understand. Be patient. Don't finish their sentences for them, and don't pretend to understand if you don't. Simply say, "Can you show me?" Or "Can you say that again?" Also remember, cognitive and communication vary widely. So trust each child as an individual rather than assuming a specific ability level. Every child with Down syndrome is unique. You will see a wide range in how they communicate and process information. Some may be very verbal and socially interactive, while others rely on gestures, pictures, or short phrases to communicate their needs. When interacting with these children, slow down, make eye contact, and be patient with them. Allow them time to think, respond, and express themselves in their own ways. It's important never to assume limitations. Always approach each child with openness and respect for their individual strengths. Next, let's talk about children who have hearing impairments. Hearing loss can range from mild to profound, and every child's experience will be different. The most effective thing that you can do early on is determine how the child prefers to communicate. Ask questions like, "Do you read lips?" or "Would you like me to write things down?" By identifying their communication method up front, you immediately show respect and you start building that trust. There are several communication methods that you might see. Some children use oral communication and lip reading. Others rely on sign language, gestures, or those facial expressions. And many combine these with assistive devices like hearing aids or cochlear implants. It's important to stay flexible. Use whatever methods help the child understand you best. And remember, communication is about connection, not perfection. So don't be afraid to try multiple approaches. In some cases, communication might include drawing, writing, or even typing on a tablet or computer. You might also see the use of visual aids or graphic images to convey information. Be patient with the child in what they are using. Give them time to type or point without interrupting them. These methods are their voice, and giving them that space empowers them to participate fully in their care. American Sign Language, or ASL, is one of the most recognized ways children with hearing impairments communicate. It's not just a collection of hand gestures, it's a complete language with its own grammar, structure, and tone expressed through facial movements, as well as even learning a few simple things like hello, hurt, or okay can help break the ice and show that you are making an effort. I did learn that this means throw up, and I learned that the hard way. If an interpreter or caregiver is present, direct your communication to the child and not through the adult. This reinforces that you see and value them as your patient. Some children have physical disabilities that make it harder for them to express themselves. Conditions like muscular dystrophy, cerebral palsy, or paralysis. These physical barriers can affect movement, speech, or even facial expressions. But here's something to always remember. Not all physical disabilities are tied to developmental or cognitive delays. A child may be completely alert and understanding everything you say, even if they can't respond verbally. So take your time, be patient, and use whatever communication method works best. Eye contact, gestures, or those assistive devices. One of the most common mistakes providers make is underestimating a child's understanding based on how they look or how they move. Avoid assumption and always communicate directly with the child, even if they are nonverbal. Ask the caregiver, how does your child best communicate? Or, what signs should I look for if they're uncomfortable? What is their giveaway? These small adjustments show respect, build trust, and make you care, and make your care shown, and then the care that you give more effective. Remember, our job isn't just to treat the condition, but to make sure every child feels heard, understood, and safe. As we wrap up this section, think about how communication is the foundation of all pediatric care, especially with children who have special needs. When we adapt our approach and use people-first language and take time to listen, we make care not just clinically effective, but compassionate as well as human. Today, more children than ever are living at home with complex medical technology. As community paramedics, it is essential that we understand what this looks like in practice. You'll often encounter children who depend on respiratory support, things like supplemental oxygen, nebulizers, or even those mechanical ventilators. Others may rely on nutritional technologies such as GI tubes or pumps for medication and hydration. Our first responsibility is being familiar, knowing what each device does, recognizing normal operation sounds and readings, and spotting when something isn't working right. Never be afraid to ask the caregiver for a quick rundown. They live with the equipment, so they're going to know it the best. And every day, ask if you need another breakdown, and ask yourself about the best resource in the field and how you can find that information. An increasing number of technological children dependent are being cared for in their own homes rather than the hospital, and that means our role often extends beyond the emergency call. We're part of a coordinated care team that includes parents, primary care physician, case managers, as well as specialists. Communication, once again, is always key, and it's the easiest thing to screw up. So when you arrive, introduce yourself clearly, assess the child's baseline, ask the family what's normal for their equipment. Document any alarms, tubing changes, or caregiver observations. Above all, approach every visit with calm professionalism. These families manage complex routines every single day, and your confidence helps reassure them that their child is in safe, capable hands. So we are wrapping up this lesson on communicating with children who have special needs. I want you to remember that everything we've discussed does tie directly into the work that we do right here in our own backyards. Our region has a large rural population and limited pediatric specialty access, and a growing number of kids who rely on community-based care. So even if your program is not yet there, keep in mind we may be moving there one day in the near future. Whether you're responding in Polk, Henderson, or the mountain areas beyond, or down east, these communication strategies make a real difference for families who depend on us, both for clinicians and as advocates. For IBSC, your community paramedic exam, keep key points in mind. You'll often see scenarios emphasizing communication barriers. Know how to adapt your tone, language, and approach based on developmental stage or condition. Expect questions on people-first language and the importance of family-centered care. Be ready to identify appropriate interventions when dealing with children with ASD, Down syndrome, or sensory impairments. The focus will be on safety, respect, and patient engagement. Lastly, remember that technologically assisted children may appear in both exam and real-world cases. Understand basic respiratory and nutritional support, equipment, and your role within this team. These principles aren't just test prep, they reflect the kind of compassion, skilled care that defines providers here in Western North Carolina. When we combine empathy with clinical knowledge, we become more than responders, we become trusted partners in our own communities. That's wrapping it up for this presentation. The next one is going to be on geriatrics. I will see you for the next session.